Good afternoon, everyone, I guess. I'm Alison Doherty, and along with Kaleigh Pennock, we're very pleased to be here in part of the 2023 CIRC Concussion and Sport Symposium, and part of the conversation that CIRC is definitely leading. We're going to be sharing part of our research team's broader project, which focuses on a multi-level understanding of influences to knowledge of concussion and reporting and removal from play in the context of youth sport. Our presentation today dials in on the reporting or disclosure and removal part of the project. That is, influences to whether or not a suspected concussion of a youth athlete is disclosed or reported, and the athlete is removed immediately. So the research team I'm referring to comprises the members listed here in alphabetical order, following myself and Kaleigh, along with their area of focus and affiliation. And you'll see that we have academic disciplines of sport management, law, psychology, sociology, medicine, and health promotion included, as well as sports stakeholders from local, provincial, and national levels representing injury prevention and safety, coaching, and sport clubs. I'm going to turn it over to Kaleigh now to provide some background to the project.
Perfect. Thank you, Alison. So across Canada, we see continued efforts towards the effective management of concussion in youth sport, including continuing education, awareness campaigns, and guidelines and regulations such as Rowan's Law in Ontario. However, there's ongoing evidence for continued underreporting and low likelihood of removal from play, indicating that these issues are persistent and frequent even at the youth sport level. So this gap between concussion management practices and continued underreporting and low removal rates suggests that there may be inconsistent assumptions and ambiguity concerning the roles and responsibilities of those involved in youth sport. So a fragmented approach that focuses on individual strategies rather than collective action may be limiting our understanding of this issue in order to make improvements towards positive reporting behaviors. So our project is really focused on examining how multi-level factors and various sport actors influence concussion reporting and removal from play behaviors in youth sport. And one of the primary outcomes of this work is to transform our understanding of these influences on reporting and removing behaviors to then inform policy and practices regarding concussion safety at the youth sport level. So as Alison highlighted, this work is really driven by a great team that's working from an interdisciplinary approach. So interdisciplinary research is particularly suitable for complex or messy problems, which describes the current landscape of concussion management quite well. An interdisciplinary approach emphasizes how a diverse team that brings in a variety of perspectives allows us to shift our thinking about a phenomenon where we can leverage the individual strengths of team members in order to collectively relate, integrate, and relocate our understandings of concussion management related to reporting and removal. So with respect to project parameters, our primary focus is on youth 12 to 17 years old, which for some athletes is their starting point into sport, and for others it represents the peak of their participation in organized sport. And as this age group is still legally regulated by their parents, we are interested in how parents and other actors that I'll mention in a moment are involved in reporting and removal decisions. We're also focused on the club sport context regarding concussion management rather than the school sport system. So the club sport setting offers the potential to inform policy and practice throughout the Canadian sports system rather than the school system, which may be regulated by their own guidelines and policies. And then finally, we're focused on various key actors within the youth sport context. So that includes the athletes themselves, teammates, coaches, parents, as I mentioned, club leaders, and on-field officials or referees. So these athletes can all play a role in reporting an athlete's suspected concussion. So whether it's the athlete themselves self-reporting, a teammate reporting, and so on. And some of these actors also have the potential to remove the athlete from play, including coaches, parents, and referees, as we just heard in the earlier presentation from Mike and Ryan on referees in rugby. So we're really interested in understanding the influences to these actors regarding reporting and removal. So at this point, we would actually like to hear your thoughts on what some of these influences might be. So why you think various actors may not report a potential concussion. So if we can enable the chat function here on Zoom, we would like to invite everyone to take a minute and write in why they think a specific actor may not report. So this could be a parent, a referee, a teammate, a club leader, what are some of the influences or some of the reasons why they might not say something about an athlete potentially having a concussion? So we invite you to use the chat function now to share your thoughts.
Okay, so we're getting lots of ideas. If you can also indicate which actor you're referring to. So the very first one, don't want to come out of the game. That's presumably an athlete. We've also got don't want to let the team down, getting pulled from gameplay, embarrassment, not wanting to be a bother. The athlete in question is a high-level contributor, so this could be a factor influencing why a teammate, a coach, or parent may not want to pull them. Fear of being removed, a teammate doesn't want to tattle. What about parents? Some of you may be parents and maybe have had a child with a concussion, or you've seen other parents. What might be some influences to why a parent would not report or why a coach would not report? We've got here a lack of education, unsure of what to do. That could apply to anybody. Feel like they're wasting money. I'm thinking that's the parent perspective. Don't realize it's a concussion, middle of a tournament. What about a club leader and an on-field official? We've just heard about the blue card program. Why would an official or a club leader not step in to when they see something going on? Coach wants to win. The official says out of sight, out of mind. So maybe it's happened, and then that's not really part of the game that they are monitoring. At least for now, parents lack knowledge. Okay, we've got lots of issues going on here. Old school, parents are old school. Parents have ambitions for their child. They don't want to make a mistake. Okay. Wow, you folks are really turned on by the symposium so far. Lots of ideas coming up here. So we're not losing the chat, but we can just close the chat, and we're going to move on from these great ideas. And we read about a variety of influences, and maybe we can still think of others. We cut off the chat, but it could still be going on with other examples. And these examples have come at different levels of the sports system, if we want to think of it this way. And this aligns with the socio-ecological perspective. You may have heard about this before, but this guides us to consider the potentially complex, multi-layered and interacting influences to individual behavior, such as reporting and removal. And this model's put forward by Bronfenbrenner and all. So the socio-ecological model comprises nested layers of influence that can be conceptualized as intrapersonal, then interpersonal, organizational, regulatory, policy, and societal levels. So we see that this progressive nesting effect. And so the framework allows us to account for a variety of factors, and in doing so, perhaps situate an individual's behavior, such as reporting removal, in more distal influences, such as societal values. So it's not necessarily what's going on immediately in their interpersonal environment with others, but what is going on in the broader society. And so the socio-ecological framework is valuable for guiding research into particularly complex problems and designing multi-level interventions to target specific behaviors. And it has framed research and practice focused on multi-level influences to other risky behaviors, such as smoking cessation and seatbelt use. And so we've conceptualized the multiple levels of influence to the key actors reporting a potential concussion and removal from play. And so this particular figure focuses on the athlete themselves as the one who is behaving. Is the athlete going to disclose that they think they may have a concussion? Are they going to report that to the coach or whoever they think they should report it to? And the potential influences to that. And so we can see that the potential influences at these successive levels could be the teammates, the coach, and the parents at the interpersonal level. It could be the club, perhaps club leaders are dictating this. Maybe the culture of the particular club will influence them to report or away from reporting. The sport officials could be an influence at that level. Concussion policy and guidelines may be an influence to reporting. Education that the athlete has had, the sport rules and what is required. And then we can consider the even more distal sport-related values and social norms. And we certainly did hear about examples of influence at these different levels. And so with identifying several factors who may have a direct role in reporting suspected concussion and or removing an athlete from play at the youth level, it means that each actor has their own socio-ecological framework of influences to their behavior. And so in addition to the athlete themselves, we can consider teammates reporting on another athlete, and this has received a lot of attention in practice and in guidelines, and the potential influences to that may come from the athlete themselves. They're not going to report a teammate because they don't want to tattle. We had that example put forward. Perhaps the coach and the parents are going to influence the teammate whether they report on their on the athlete that was hurt, and so on at the other levels. And so we consider the same for the coach and for the parents, and imagine that the coach reporting and removing an athlete from play may be influenced by the athlete themselves. This is our star athlete. Maybe other coaches are pushing them to report, and they do that. That's a positive influence. Maybe the parents, they know that the parents will be really upset if they pull their child, and so on. There may be a club. The culture of the club is that coaches take the lead and pull without question. Maybe the sport officials, if the official didn't see it, then why am I going to do it? And so we can consider these multiple influences, and the same would happen at the parents' level. And so we can also see that the models are inherently connected, as one actor, such as a parent, may be an influence to another party's behavior, such as the athlete, while they themselves are influenced by a number of levels. So a parent's likelihood of reporting a concussion may be influenced by societal sport-related values, may be influenced by the education they have, and their education may influence whether the athlete is going to report based on what their parent thinks. So we can start to see not only the levels for each actor, but how these levels may potentially cross. And so we can also consider that the same factors may influence actors in different ways. So, for example, concussion guidelines and coach versus parent behavior. Parents may respond differently to concussion guidelines than a coach responds to that when it comes to reporting. And I'm not going to take up another slide, but we would also have similar models for club leaders and for the on-field officials. And so the next steps, which are underway, are to review the empirical research on influences to reporting and removal, both intention and action by athletes, teammates, parents, and these other actors that we've identified as key in the youth sports setting. We're synthesizing evidence of both facilitators and barriers to reporting and removal, and identifying any connections among the actors and those influences. So in essence, we're filling in the levels in each model as available research allows to uncover the story of what is known to be shaping various actors' behavior around disclosing and reporting and removal from play. And this will also allow us to identify gaps in knowledge at the various levels, which we are already hearing are being filled by some of our colleagues. And so our multi-model project, again, representing each actor, will highlight a multi-level in understanding of influences to reporting and removal behaviors of these particular key actors. And in doing so, we can highlight the potential complexity of the influences and highlight where attention can and should be directed for effective education, policy, and practice around management of concussion in youth sport. And these highlights can inform and support collective action for less fragmented guidelines, more consistent practices, and clearer, relevant messaging for effective reporting and removal going forward, including the implementation of the soon-to-be realized harmonized approach to concussion in Sport Canada. So on behalf of Kaleigh and the rest of the team, I thank you for having us, and we look forward to sharing our findings soon, and happy to entertain any questions now.
Okay, that was incredible. I think we already understand the complexities when it comes to reporting a concussion or self-reporting. When you show those diagrams that way and all those levels, all the actors, it's crazy. It's crazy. So with that in mind, with so many levels of potentially influencing concussion reporting and removal, where do we start with targeting change towards increasing the prevalence of reporting? And I know you're still in early days in your project, but if you were to take a wild guess or an educated guess in your case, where would we begin? Where do we even start?
So I think where we start is by, as you say, acknowledging the models that highlight the multiple levels of influence. We know this is a complex issue because it's been very challenging to continue to take steps forward and make progress with it. And a big reason is because of these different levels that can impact on that. So it's not sufficient to consider what influence can a parent have on a child, but what are the influences to the parent? And if the coach is also influencing the child or the athlete, what's the relationship between the parent and the coach? And so we are seeing this in the research. We're seeing examples of the parent and the coach relationship, and the coach responding, what they think of the parent's attitudes, and that's going on. But we need to bring that together and consider all these levels. And so there's a comment there for sure. Start with Rowan's Law, but as an example with Rowan's Law, I think we can benefit from aligning Rowan's Law with this multi-level perspective to see, are all the levels considered, are particular levels considered, are some missing, and maybe we can find some gaps or things that need additional attention.
Well, thank you. And we will look forward to those results, Alison and Kaleigh. You have a lot of work ahead of you. And like I said, we can't wait to hear those findings and share those findings once you're done. I can't thank you enough for joining us this morning, or actually this afternoon now. And we wish you the best of luck in your research moving forward.